Welcome once again to Success Magnet Network. We're so excited to hear from Dr. Nafisa Sekandari, and she is a clinical psychologist, but she is not just your regular clinical psychologist. She works with all ages, all different types of situations, and I'll let her explain to you how she is different because she wouldn't be on the Success Magnet coaching team if she wasn't different, if she wasn't unique, if she didn't have something to share that would enhance everybody's lives. So again, we're so excited to have you on the program here. Please share with us your situation and how you are different, doctor.
Hi, thank you so much for having me here. I'm so excited to be a part of the Success Magnet team or part of the coaching team, and I'm excited to deliver the best services for the people that are really struggling with any kind of mental health issues. I specialize in anxiety-based disorders, but I'm also a holistic and integrative psychologist where I help patients to feel empowered with the effective and proven strategies and tools and techniques where it connects their mind and their body, and that they're able to not just address the symptoms, but really feel as healthy and optimized in their lives as possible. And I like to not only get to the root of the issues, but there are also a lot of ways that we sabotage ourselves. We kind of sabotage our day basically with our diet, with our lifestyle, with the lack of sleep. And so that gets our brain stuck. We're more reactive. We're feeling more stressed because we don't have the right coping strategies. And so allowing somebody or teaching somebody the skills and the effective and proven tools can help you live a more optimized life and have all the energy that you need without being more stressed and without being uh, just overwhelmed and more reactive in life.
I love that so much, doctor, because a lot of times people hear the word clinical psychologist and they just want to like run the other way. Why do you think there's kind of that reputation or that stigma versus how you think it should be? And again, we're not talking about all clinical psychologists. We're talking about you and your specialty about helping people holistically.
Well, I mean, when I had to do therapy, when I was in graduate school, I had to do 50 hours of therapy. And I'm so glad that they forced us to do this because it can be very intimidating on the other side of the desk, right? But just going to a therapist should be a conversation. It should be just talking to somebody that's not connected so much, and it's an objective observer of your life that can give you pointers. It's not somebody that's going to shrink your mind. I mean, there's a lot of negative stigma around therapy, like what kind of powers do we have that we're going to manipulate you and manipulate your life? And we don't have those kind of powers. Are there bad psychologists and therapists and people out there? Probably, but that's not all of them. And I think the majority of them truly do get in this business because they want to help other people. And the beauty of it is if you don't connect with somebody, that doesn't make therapy bad. That just means that's a really bad connection for you. Go and interview other people until you find the right person. And once you find the right person and you click, that person can be on your team and really support you in ways that you probably never thought you could get the help that you need. Because a lot of people are like, well, I have family members. Why would I need to go pay somebody to talk to? But your family members are way too close to the situation, and they're not able to see the situation the way um, that somebody that's not connected to the situation would. Somebody that's objective, somebody that's able to see the bigger picture. Sometimes you have family members continuing to support you and encourage you and enable you to continue to live a lifestyle that's actually sabotaging you and making things worse. So getting an objective feedback, an objective lens on what's going on with you can actually help you heal faster and move forward in a lot faster way, in a healthier way than if you're just depending on family members or friends.
I love that phrase, objective observer. And I know that you've done that hundreds, maybe even thousands of times in your life. We all have to an extent, but your specialty is helping people to recognize themselves and recognize their challenges that they're going through, and then help them create solutions, right? So how do you do that? And I think in a pre-interview, you mentioned to me about you don't really recommend the medication like some psychologists or psychiatrists would do. How do you justify that? And can you give us a maybe a heartwarming story about one of your clients who, has really been impacted by your philosophy?
My whole goal in life is to empower the people that I work with, whether they're my patients, my coaching clients, my online students, and that kind of work myself out of a job. Basically, I want to give you the tools that you need so that you don't need to in the middle of the night go, oh my gosh, I can't talk to my therapist. What am I going to do? Or I ran out of medication. What am I going to do? Like your whole world is falling apart. So what I found through this whole my five pillars to mental health, which is addressing your mindset, your behavior, your physical health, your emotional health, and your spirituality. You're addressing every aspect of your life, and you're feeling empowered, and you have the tools to, like, I want to give you all the tools for your imaginary tool belt. So whenever something comes up, you're able to rely on that instead of freaking out that you don't have the medication or you don't have the therapist. You're not always going to have access to medication. You're not always going to have access to a therapist. And the fact is, the majority of medications, they create a dependency that's not making you feel empowered. It's making you feel dependent. And you were asking about a feel good story. Well, I do have one where I had a patient who was on his way. He was actually in London when he called me, and he was freaking out. He's like, I'm here for 3 weeks and I don't have enough Ativan. I don't have enough medication for my anxiety, and I'm going to turn back around and come back home. And I was like, there's no way I'm going to let this guy come back home, because he has been looking forward to this. He booked it for 3 weeks because he was going to follow this favorite band of his across multiple cities in London. And he had already bought his tickets. We've been planning for this for months. He was so excited about it. And then the thought of not having enough medication freaked him out so much that he was going to turn back right around and come back and forget all about it, and not even worry about getting his money back for the tickets or the hotels that he had booked, all the tickets that for the train rides. And I was like, I can't let him do that. And so we talked to him, we calmed him down, and we even like broke the medications down so that it lasted the 3 weeks, and just even if it was a little bit. But the thing that he ended up realizing after this trip is he didn't even take a single Ativan that entire trip. He relied on the tools that we talked about. Yeah, he relied on all the tools that we had been talking about, and helping him. And he had such a good time. And he was so happy that he went through it and he stuck it out, and that he didn't give up, because that would have been his biggest regret, to have run back home and not seen this favorite band of his that he has loved since childhood. And so that was a huge empowering moment for him, that he did not need that Ativan. But the fact that he just had it in his pocket, even if it was like cut up into tiny little pieces, the fact that he had it in his back pocket, that was enough for him. And he realized he didn't even need it anymore. He already had what he had inside of him. That was more than enough to help him get through those three
Wow,
weeks.
there's tears coming to my eyes right now. I'm like, oh boy, that is such an impactful story. So that's a guy that you've been serving. So do you specialize in anything in terms of women or children or elderly? Tell us a little bit about how you work with those different groups as well.
Yeah, I work with all age levels. For before I became a clinical psychologist and got my doctorate, I was a school psychologist for 6 years. So I worked at the schools at the elementary level, middle school, and high school levels. And so I'm used to working with all of those age ranges. And I do have patients right now that are teenagers. Because I'm virtual only, a lot of little kids don't do very well virtual, so I'm not necessarily seeing them. But what I do when it comes to virtual, I help the parents. I teach the parents the tools and the strategies to help their kids, because a lot of times it's not necessarily about the child at that point. A lot of parents, they don't even realize that they're perpetuating bad behavior without even realizing it. And so empowering the parents really gives them that sense of confidence to help their children, where it also calms the whole environment, where the kids are not as reactive either. And it creates a deeper bond and a deeper connection between parent and child when they have the right tools and strategies to work with the kids. And then, of course, I do work with teenagers, and I also work with the elderly. And my biggest group that I focus on right now are women between the ages of 35 and 50. These are high achieving, driven women that burn the candle at both ends. They're working so hard, they're so driven, but a lot of times that drive is fueled by fear and anxiety, the fear of success, the fear of failure, the imposter syndrome, the just not feeling like they're good enough and being judged, the perfectionistic tendencies. And so all of that ends up catching up to them. You know how with diet and exercise, we can't get away with the same things we did when we were in our 20s? Well, it's the same thing with mental health. The same things you got away with in your 20s, you're not going to be able to get away with in your 30s, 40s, and 50s. The fact that I could have stayed up all night and then go out the next day and do my classes and take a test and still hang out in my 20s, I can't do that now. Like if I'm not in bed at a certain time, I'm a mess the next day. And so working with these women, the reason I became so passionate about it is because a lot of my patients were getting diagnosed with depression and anxiety around those ages. And that wasn't their issue. They were getting prescribed medication and they're like, I'm taking all these meds and I'm not feeling good. It's like, but that's not your problem. Your problem is not depression and anxiety. That is a symptom based on a lot of other things that are going on during this age. At age of 35, typically, I mean, sometimes it happens earlier, but typically 35 to 40, your hormones begin to decline. So your mood changes, you're not feeling as energetic, you're more reactive to things. There's a reason that a lot of marriages fall apart around the time of menopause or perimenopause because women are dealing with so many things that it's creating a lot of conflict in their lives. And medication isn't going to be the solution in that situation. Learning the right strategies and tools and taking care of your mind and body is the solution. So that's one passion that I have. And I really want to help these women feel empowered. Not that I want to stop them from being so driven. They can still be driven, but not be driven by fuel. I mean, they're driven by fear or driven by anxiety, but making the choice to continue to drive and still be very productive, but not burning themselves out, not feeling so overwhelmed, not feeling so stressed. And then, like I said, I work with the elderly as well, with dementia, cognitive issues, but also there's a lot of depression and anxiety going on with the elder population as well. There's a lot of drug use going on with the elder population. And so my goal is to help them. And the sad thing is, you know, I went to this one training where they talked about how the majority of individuals after the age of 70, they have so many different types of medications they're taking that they can literally come to the doctor's office with a bag full of meds, but the doctor never teaches them about lifestyle changes, about dietary changes, about addressing past wounds and trauma. I had a woman, she was in her 80s, and she was still dreaming and reacting to sexual abuse by her father when she was 19, as if it was just happening still. And that's the thing with trauma. If you don't deal with it, it will not go away. It stays as fresh as the day it happened until you deal with it. And so here she is in her 80s, and that trauma affected every aspect of her life, from her parenting to her marriages. And now in her 80s, she's having these horrible nightmares about her dad, who had been gone a long time ago, but it was still affecting her. So yeah, I work with all age ranges. That was just a little snippet. Sorry if it went too long.
Yeah. Well, I remember a psychologist telling me one time that if you bury the past will bury you. And I
Mm,
think that's so true. Not dealing with things, they keep coming up over and over again. It's like the same fight you have in your marriage over and over again. And as an observer here, listening to you talk about your practice and how you help people, I can feel your heart. I can feel your enthusiasm. I have a degree in psychology myself, and so I've been around a lot of psychologists, and I would say that they're not all perky and happy. Like a lot of them are very, draining. when you when you meet with them, it's like, oh, can't you tell me something positive that's going to happen or whatever? I feel like if I were to meet with you and I want a solution in my life, that you would be not only objective, but positive and enthusiastic about my ability to change. And that's what I want to see. I really heard you say to me, I want to work myself out of a job. How many times do you hear that? There was just a news clip that I heard yesterday that for the majority, psychologists and psychiatrists want to keep people on medication. They want to keep their clients coming to them all the time. I feel like you work differently. Tell me a little bit about why you decided to do that. Have you always been that way?
Well, I think something that I think Dr. Daniel Amen, he's a psychiatrist that he actually scans people's brains, had said is if all you have is a hammer, every problem becomes a nail, right? If the only thing you have is medication to rely on, everybody's going to need the same thing. They're all going to need medication. I tell a lot of young psychologists, especially the ones that are in graduate school, they contact me. They're like, what is something that I need to know now? And I'm just be multimodal, be multifaceted, really educate yourself, teach yourself about many different tools. And I even say this to my cousins that are becoming medical doctors or physician's assistants or just going into the medical field. It's like, don't make everything about medication. There are so many other ways to help people. And for me personally, I ended up getting diagnosed with endometriosis when I was in my 20s. And I didn't have insurance. I was in graduate school. I didn't have money to have the surgery. And so all I had was, okay, well, what can I do? And at that time, this was before the internet. So I found this book. It was all about herbs for health and healing. And it was this nurse that wrote this book. It was an amazing book. And it really taught me about essential oils, about herbs, about natural solutions, about castor oil packs, about acupuncture, about all these different ways for me to heal myself. And I had diagnosed with endometriosis. I had a 10-centimeter cyst on my ovaries, which is the size of my fist. It was a huge, and imagine your ovaries the size of a walnut, and it's a huge cyst sitting on top of it, right? And so it was so big that they said if I didn't have surgery immediately, that could burst and just rupture everything and just destroy my pelvic area. And I was like, I'm not going to let that happen. I had acupuncture. I changed my diet. I changed my lifestyle. I started using all these different strategies and techniques. And then I realized there's a whole world out there that's not solely dependent on the Western medical system. The Western medical system obviously has its place, but there's so many other things that we can do as well. And not everything, like if all I have is a hammer, of course, everything becomes a nail, right? But I have so many other tools under my tool belt right now. And I have so many other strategies. And this is why I consider myself a holistic and integrative psychologist, in that I use many different strategies. I'm not just, okay, let's focus on CBT or cognitive behavioral therapy. Let's just, or focus on medication. I have so many other tools that I can get into to teach you, to help you, because not everyone fits the same size, right? Not one size fits all type of thing. Everybody comes with different issues, and I want to really figure out what's going on with them and help them at that level, instead of saying, well, everybody gets medication. It's like, Oprah, you get a car, you get a car, you get medication. Not everybody needs that. Other people
Yeah.
need other things. And so that's what I like to focus on. But it all started with helping myself, and then helping my family, and then reaching out to helping other people as well.
I feel like you have lots of arrows in your quiver, so to speak, and that you can pinpoint exactly what you need to help. But it starts with a phone call. Yeah, literally, nobody's going to get a key to the lock to your beautiful safe with all the, gold and silver and precious metals inside of there, all those wonderful gifts that you have. You can't have access to it unless you actually speak with Dr. Sekandari. You see, she is willing to do these appointments. If you feel like there's something that she has said today that resonates with you, just click in her profile and you're going to see that there's a place that you can get a free consultation. And I would definitely encourage you to do that. I feel your heart. I feel like I could trust you with every part of my life because of the way that your philosophy is. So thank you so much for being with us. Did you have one last thing to say? Is there something I missed? I just want to make sure we get a bit of all of you today.
Oh, I so appreciate you having me here. Thank you so much. And like I said, I am willing to work myself out of a job because I'm so passionate about helping people. And my goal is there's no need to suffer when there's so many solutions available. And that's my goal for everyone. And I want to make this a global thing, and that there are people around the world that have contacted me that they don't have access to mental health providers. And I want to give them these tools that they can have and use no matter where they are located, and that these strategies are free and available to you once you learn them, and you can apply them anytime. You don't need to wait for somebody to tell you what to do once you have the skills, and you can use them for the rest of your life, but also you can use them with your other family members as well. So that's just my goal.
Exactly. We're so excited to, be able to dive into more of your information and to be able to connect with you. Thank you for being part of our Success Magnet Network and being one of our elite coaches. And this is a great journey for all of us. And thank you for being with us today.
Thank you.